Hi mate, what's your name?
Hayden.
I'm Lewis. I'm going to be your practitioner today, and you've come to me with an injury, so I'm going to be taking you through a subjective and objective assessment to get a bit of background information and see what the strength and range of movement's like, and then give you some advice and create a rehab sort of plan. So the subjective information we're going to do, I'm just going to ask you a bunch of questions, give me an idea, give you an idea of what's wrong, and from there I'll just ask you about lifestyle, how the injury happened, what it is, and then give you as much advice to help with you. And then after that, there's objective information, take you through some range of motion techniques to see how much movement you've got in the joint. This may require me to assist with moving the joint, so wherever the injury is, I'll hold this support, and then after moving, give me a score, and from there I can give you some advice on rehab and that sort of stuff. So yeah, you happy for that to proceed?
Yeah.
Maybe. Have you got any questions?
Yeah, just how long will the whole process take?
Yeah, not long. Less than 10 minutes should be. Just want to get an idea of everything and then give you a rehab plan from there. And if you want to withdraw at any time, just let me know, and happy to do so.
Perfect.
Okay, Hayden, why have you come to see me today?
My ankle.
Is it? Which ankle?
Left one.
What have you done to it?
I was playing tennis.
Yeah.
I've come forward to hit, return a drop shot.
Yeah.
I planted my left ankle and rolled it, and felt a pop.
Felt a pop. Okay. So it was an outwards roll or inwards, or you unsure?
Outwards roll.
Okay, that's fine. How long ago did that happen?
It was 4 days ago.
4 days ago. Okay, that's lovely. Have you been to see anyone since, or had any sort of rehab advice?
Yeah, I went to hospital.
Yeah.
Straight after I did it. Got an X-ray. And they suggested it was a sprain.
Just a sprain. Okay, that's brilliant. That's fine. How painful is it as of this moment?
So at the moment, it was better than it was when I did it initially.
If you could scale it on 1 to 10, with 10 being the most painful, how would you rate it just at rest right now?
Probably about a 6 out of 10.
You can feel it, okay, at rest. And how was it when the injury happened? Do you remember?
Yeah, after the pop, the pain shot straight up to about an 8 out of 10.
It was an 8, okay. Have you been on any sort of medication, paracetamol, ibuprofen, or anything stronger than that?
I've been taking paracetamol.
How
that's what the
often?
doctor said. Take it by the packet as well, every 4 hours.
Every 4 hours, okay. Yeah, that's fine. Is there anything, what are the, I'm going to call them aggravating factors, that, so what you do just shoots the pain up from that 6 to any higher number?
Yeah, it's just pain when walking.
Yeah.
It was a lot worse, especially when going upstairs.
Have you been any crutches or anything assisted while you're walking, or just?
It was given a brace.
Yeah.
From the doctors.
Have you been wearing that?
Yeah, when I can.
That's fair enough. When you say so, going upstairs. What about downstairs?
We're still painful going downstairs. But not
Still okay.
Not so much going
What about any easing factors? So, have you been doing anything to treat it, or lying down, stuff like that? Just take the pain a bit lower or completely away?
Yeah, I've just been trying to rest it when I can. Obviously been taking the paracetamol, and yeah, I've been icing.
You've been putting ice on it, yeah.
I wouldn't say I'm doing it routinely. I'm just sort of icing one
every now and then. Okay, that's fair enough. Have you had any past injuries to either of your ankles or any lower body injuries?
Yeah, I previously sprained this ankle before.
The same ankle, was it?
Yeah.
Okay, how long ago was that?
It was about 6 months ago, yeah.
And how did you do that one?
It was the similar.
Same,
roll.
playing tennis or?
Yeah.
Okay,
Yeah.
that's fine. What do you do currently in your day-to-day life that makes you, like, what's your job?
So I'm an office worker.
Okay, so during the day it's not very, you are just lying down. Do you find the pain gets worse throughout the day, or stays the same?
It's worse in the morning, definitely easiest through the day.
know when you went to the doctors, did they give you any rehab exercises for it, or are they just taking you paracetamol?
Yeah, it was given a booklet, but to be honest, I'm quite reluctant to.
You haven't looked into it, okay. No worries, that's fine. Alright, going back to your previous injury, you said you did it 6 months ago. 6 months ago, was it?
Yes.
Did you see any practitioners back then, or let it just heal itself? Or?
Yes, I saw the physio.
Yeah.
Saw the physiotherapist, but that was about it really, and the doctor.
Did you follow? Did they give you a plan to follow?
Yeah. Well, to be honest, I wasn't particularly great at following it.
How do you think it's recovered since then? Did it before? Obviously, this one, was it perfectly normal? Would you say?
Yeah, it felt okay. So I was back.
Did you have any pain with that? Was there any aggravating factors that led to more pain now and then?
Yeah, I was a little bit sore, like after I finished playing.
Yeah, after games. Okay, yeah, that's fine. Sorry. So back to this one now. Would you say? Could you show me with your strong foot what movement patterns cause the worst amount of pain? So would it be flexing it up, down, or either side?
So when I put my toes down.
Yeah, that's when you feel the most pain, is it?
Yeah, when I put my toes
and turning them
towards my body. Yeah.
Okay. Back to your past. Have you, aside from the ankle injury now, have you got any previous medical information I should know about? So have you ever been on medication for any sort of diseases, stuff like that, or just injuries?
No, apart from the previous.
No asthma, not diabetic, anything like that?
No previous.
Okay, that's fine. Okay, well, moving on from the subjective assessment, that's all I need to know, so thanks for that. We're going to be doing an objective assessment next, which will require me to assess how severe the injury will be, and this can require me to assist you sometimes, so I will need to hold your foot and just take it through the range of movement to see how painful it is. Is that okay with you?
Yeah.
Brilliant. Cheers. Okay, so now we moved on to the objective assessment, and here I was just explaining to Hayden that I will be testing his active range of motion and his passive range of motion, and that it might include me physically assisting him just to test the range of movement that he's got in both of his ankles. So we first move over to the strong foot, the uninjured leg, and here I'm explaining to him to point his toes as far back towards his shins while keeping his knees locked in to test the ankle flexion. And then the opposite, I was telling him to point them as far down as he can to test the ankle extension. And then I asked him to point his toes inwards for inversion and then outwards for eversion. And while doing this, I was making sure for him to tell me if there was any pain. Moving on to the left leg. First of all, again, I instructed him to point his toes backwards towards his shin and then forwards towards the floor for his flexion and extension. Again, I was checking on any pain, and then we did the inversion and eversion for both of these, and here I did notice that there was slightly less range of movement and he did feel a bit more pain while doing those movements. Here I explained again that I will be assisting his feet here just to gain his consent. So there I was putting his foot into ankle flexion and then extension and really pushing him to those tight ends. This was eversion and then this was inversion. Really using my body to get the ankle through the maximum range of movement. Now onto the injured leg, the same process. So I put my body behind the foot to get him into ankle flexion and then place it into ankle extension. However, here Hayden did tell me that he could feel pain, and that wasn't a good sign. Then ankle eversion and inversion followed. Seeing how far it was, and that didn't feel too bad for him. And then that was the end of the objective assessment.